All right, so now we have the shoulder. This is another very important piece of the evaluation. The pelvis, the hip, the knee, and the ankle, we already covered, and this is the final component that we're going to cover today in the postural analysis. The scapulas set equidistant between the spine here of the thoracic spine. First measurement that I like to do is find out where the spinous process is and where the vertical scapular border is, or the medial border of the scapula. From this position of the spinous process and the spine, it should be 3 inches. Okay, so you can get a measure and tape out and measure. If we are greater than 3 inches, we're dealing with a protracted scapula. So these muscles, remember the facing muscles of the rhomboids, are in a lengthened position. If we're less than 3 inches, then we're dealing with somebody that's overcontracted in the rhomboid area, and that leads to tightness in the mid-back. We often see this with weightlifters, actually, because we do a lot of pulling, a lot of pressing, a lot of things that hold our shoulders back. A lot of people actually will correct their posture by squeezing their shoulder blades back, and that's actually not the correct way to correct your posture, and I'll cover that in a moment. Because when you do that, you create a muscular imbalance. You actually get the rhomboids in a shortened state, and your serratus anterior that runs underneath the scapula and hooks to the ribs here becomes in a lengthened state, and that muscle is very important for shoulder stability when we're moving the shoulder. Go ahead and relax here. So that measurement is crucial. Again, if it's less than 3 inches, we're tight in the mid back here. If it's over 4 inches, we're probably tight posteriorly and weak in the mid back. All right, so that will guide us to what we want to do. So not everybody is going to have the strength in the rhomboids and stretch the pecs. It may be a little bit the opposite direction. Another important evaluation is the heights of the scapula. They should sit level. The spine of the scapula should be at T2 level. To find T2 is a little bit difficult, but a simple trick would be to have Cassie flex her chin forward, and that bump that sticks out is C7. Okay, pretty prominent. I'm not sure if the camera can get a good view of that. But as she comes back up, I just simply go, that's C7, go right down to the next spinous process, that's T1, and then T2. And if I come across, she is actually looking pretty good here even. All right? And just relax completely, Cass. There you go. Good. Earlier when we checked that, she was a little depressed. So that's another key point of people who you do a postural assessments on. When people are getting their posture looked at, they're going to really correct. They want to pass. They want to do well. So really be aware of somebody getting into this position. So you may have to reinforce to have the person just relax, 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 so you can get a true measurement here. So again, T2 level. If they're lower than T2, you'll start seeing the increased slope of the trapezius, and the trapezius is actually in a lengthened state. All right, and the scapulas are depressed. Therefore, there could be some tightness in the lats, the teres major, and the pecs that actually pull the scapula down because of the tightness. From an elevated position, if we see the shoulders higher than T2, then we can actually see that the upper traps and levators are overactive. So we're going to take note of that, where those scapulas sit. And then there's a component, there's many components, but the other component is whether they're posterior, or they're upwardly rotated or downwardly rotated. So again, this vertebral border of the scapula, or medial border of the scapula, should be vertical. Maybe a slight angle out. Cassie's looks pretty good here, but if she was protracted and forward, then that would be a bad angle. She would be in an upward rotated position. She also, with shoulder retraction, that scapula could be tilted forward, so we could have now an angle that tilts inward. that would be an overdevelopment, again, of the rhomboid and the levator scapula. So we want to have relaxed position, vertical border, equal with T2, 3 inches away. That's where the scapula should live. If we see deviation of that, we have to figure out what muscles are tight and which muscles are weak, because that will lead into an imbalance of synergy of when people raise their arm and shoulder, which we'll be covering in later modules. Have you turn to the side here? As in the plumb line, we're looking for the ear, shoulder, hip to be in line. She actually looks pretty good. As we covered in the upper cross syndrome, that's evident that that shoulder is anterior of the plumb line, again getting into that protracted position. If she's anterior, okay, she is retracted, so that's another check on that posterior point. And another thing to look at in the manual is whether the humerus and the elbow are in a vertical alignment. Okay, if the elbow is posterior to the shoulder, that could be some tightness into the anterior shoulder of the biceps. And if it's forward, then we have to look at other tightness in the chest and the anterior shoulder. So again, these things should be right in line, and even the wrist. You're going to see a slight flexion in most people because of our activities of daily living, working on computers, actually strength training and things like that. But again, ideally is to have that in line, a balance between the biceps and the triceps. All right, we'll go ahead and turn forward. Now, we look at, from an anterior view, is the the SC joint and the AC joint. And that indicates if there's an angle in the clavicle or not. So if Cassie is elevated, then we're going to see a steeper angle in the clavicle. If she's depressed, or her shoulders are depressed, then you may actually see a incline or a decline of the clavicle, or it's level. And right now, it's level. Normal is just slightly elevated. And of course, that is something that you just have to look at many shoulders to get an idea of what that normal is. And we're always going to look for symmetry too, also. So right here, she has a nice small angle or a slightly angled clavicle, and then you check the other side. So again, too much of an angle, shoulders are elevated, upper traps are overactivated. Too little of an angle or even of an angle, then her upper traps are not working or not as toned, and her shoulders are dropped down. Her chest and her lats could be tight, pulling her shoulder down, because when they're too tight, that's what happens. So we got to be aware. And when we get into movement assessment, we'll see how all those work together to see if there's synergy between all these muscles. All right, so that concludes the part of the postural assessment. There's more in the modules that go in depth about different shoulder positions. I'll have those things in future modules also.